Historical Advisory Committee meeting of January 22nd, 2026. If anyone here would like to address the commission on any items that we have today, please fill out a blue speaker card. Please call roll.
Commissioner Zilich,
Present.
Commissioner Smith,
Here.
Commissioner Jensen,
Here.
Commissioner Hamilton,
Present.
Commissioner Rossi,
Here.
Vice Chair Sheard,
Here.
Chair Jenkins.
Here.
Thank you.
Thank you. Please stand and join me in the Pledge of Allegiance. Salute. Pledge. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Please be seated. Is there anyone here who wishes to speak on non-agenda items? Thank you. We will move to the public hearing. Open the public hearing, regular business, and item 1. Staff report, please.
We're going to pull up the PowerPoint real fast. All right, so the first item that I have tonight is proposed facade changes for 1726 Montgomery Street. The applicant, Mark Mendez, is requesting approval for facade improvements at the property I just listed, located within the downtown mixed-use zoning district and downtown historic overlay. The proposed project involves renovation of an existing structure located on the former Orville Ford dealership property to improve compatibility for commercial use and to support an expansion of the adjacent karate studio. The proposed facade improvements include removal of the existing steel roll-up doors and the associated framing along the front elevation of the building. In place of the roll-up doors, the applicant proposes installation of a 3-coat stucco finish across the entire front wall. The proposed improvements are intended to enhance the appearance of the building, improve functionality for business use, and better integrate the structure with surrounding commercial development along Montgomery Street. The proposed facade changes were reviewed by the City of Orville Development Review Committee. During the meeting, the committee expressed concern with the proposed 3-coat stucco finish across the entire front elevation, saying that it would result in an articulated wall exceeding the maximum blank wall length permitted along a primary street. So City Code 1734030, downtown mixed-use development standards, the maximum length of an unarticulated or blank building wall along a primary street is 10 feet. The proposal that we have right now would exceed that.
Like 57.
The DRC committee recommended revisions to the facade design to introduce architectural just changes consistent with these standards. That was relayed to the applicant. I have not yet received any changes to the proposal at this time. So the first picture I have here, we can see the building that I'm discussing. So if you guys are familiar with the building across the street from here, the building that he's changing is a little bit set back from the road, but you can still see it from certain angles. So I do think that the city code does apply here when it comes to like how it should be viewed from the front street. This is how it looks right now and what kind of changes he wants to add. So those little 4 squares are currently steel roll-up doors. He just wants to put stucco over them. That's all that I have. Any questions?
Thank you. And the applicant isn't here today?
Not appear so, no.
Okay, we will, is there anyone who wishes to speak on this item? We will limit discussion between commissioners and staff then. Anybody from the DRC want to weigh in on this to kind of catch us up?
Well, essentially, we were concerned that they're going to take something that has some architecture to it with the different doors, has some recessed areas, and they were just going to make it a blank wall. It's just going to be, it's just going to be a wall. Nothing was presented as far as like even painting a mural on it or anything to make it where it's not just a where we're just staring as we're going down the street at a blank wall. I suggested when he takes the doors out, because the wall is so thick because of the doors and such, just recessing the wall and making it, you know, putting some pattern on it. Maybe each one of those openings could have a little 4-foot facade in front of it or something, you know what I mean? Just architecturally make it look better than just a blank wall. And that's kind of where we were coming from. And then apparently she looked into it and she saw that, yeah, there is a statute, and there is a code saying that he really can't just. So I'm open to whatever he'd like to do. I was hoping he had some ideas.
What, was he did he attend the DRC meeting?
No. I mean, even if he did continue what he did on the corner there, because I don't think he did the Z brick there. It looks like real brick he put up there, which I thought looked pretty nice.
Put real brick.
And if you continue that down the wall somewhere in some other form or fashion like that, it would look pretty good, so, yeah.
Awnings too. I mean, the
Yep.
code is good. I honestly think we have a great code for exactly this blank wall section. And
Yep.
I think we're in the historic district, and I think we have to keep the standard.
I think what John said too is fairly cheap. It's not overly,
No.
He hasn't
Have
done
an
anything.
inset and.
Exactly,
Yeah.
exactly. What he wants, basically, instead of just making it flat, he just builds the wall 6 inches in and then puts a little 4-foot facade in each one of those openings. And it'd be fairly inexpensive, I would think, but
Yeah.
I'd like to hear his side of it and see, you know, if he had any thoughts or ideas. But for right now, I just don't know that we can approve it just being a blank wall.
I'd like to see I'd like to see a color rendering
Yeah.
Yes.
of it with, I mean, if it's just gonna be maybe some, you know, redwood planter bosses in the front
Yes.
or some awnings.
Awnings would make
Maybe
a big
paint a-
difference.
Well,
A window, give it some depth, give it something,
Yes.
because
That's what the
what
code
is that,
says.
60-foot wall?
Yeah.
you know,
Yeah, it is.
That's one big, long wall.
I mean, I don't know about the awnings, since it's the alleyway, the traffic way of the alleyway is right in front of the building, so you can't.
Well, that's in
really
the
have-
back right here where the garages used to
They
be.
could be
Line
short.
street.
There's no driving through there.
Well, there is an alleyway right there.
You're right.
You could drive.
There's an alleyway
You can drive in
It's
the
right on
alleyway
the-
and right in front
on
of
that side
building.
to go into where the dealership was.
If you're able to pull up the view that has the entire plot,
You can
the
see it
site
from
plan.
here almost.
Yeah, you essentially can drive right in front of where those existing.
Yeah,
Okay.
there's the strip there that's on the lower end of that, that's the alleyway that can be driven through.
But
But-
if he just builds
but it
those
just-
recessed a little and puts a little facade,
Yeah, something
It's-
other than just,
Yeah, it needs something, and I agree with the way that the staff framed it and with their recommendation, that if we approve this, it's under the condition that that he submits additional drawings and that it have these, these architectural elements in it, and I would be fine with that. And since he's not here to make any other argument, that's what I would be willing to do.
I also want to say that we've got the corner activated with the martial arts, Cultivate Power, which is awesome. Before we had the other exactly back corner activated when we had the axe throwing. Hopefully we'll get that back now that it's coming alive. So I think it's important that the character is maintained, even though I know this building isn't
right.
one of our most pride buildings but still, I just think it'll help bring life back.
It's actually Cultivate Power that's
Yes.
moving into that one.
Which
So,
is
yeah,
awesome.
They're growing.
And then I know, I think my church is looking at the property behind, so see, there's gonna be a new building
Right.
there. So I feel like there's an opportunity to keep this nice.
Well, I think either way, he's spending a lot of money in construction to revamp it, so why not just make it look a little bit better for nearly the same cost, I would imagine.
yeah, I'd like to see a color
But what are we
rendering.
being asked to do?
We can approve it on the condition that he provides us some changes to the exterior. We can have it so that the planning department can just review it internally and then give him his permit, or we can bring it back to planning commission if you guys want to see it again.
I would like to bring it, in my opinion, if we brought it back in front of the Historical Advisory Committee again, more than the Planning Commission, because just to look at the colors, and get a color
Right.
rendering like what Glenn wants, and see if it's recessed, and see the architecture he's putting in. So I would like it to come back in front of us again with some new architectural renderings.
And he said. And that was his only pushback on the idea? Yeah.
Okay, so yeah, let's have Mr. David Anderson, who's a very good architect, do a nice color rendering, because he did them for me before, and submit it. That shows us, that it's just not a long 60-foot flat wall.
And just follow the code. There's a lot of recommendations right there, section 5.
Yeah, it just needs to be broken up.
Simple.
Something needs to break it up.
And our response to Mr. Mendez is, we can see the facade from Montgomery Street.
Oh, yeah.
Yes, we
No, I
can.
see it all the time, and
Yeah,
I walk the alley.
yeah.
It sounds like we have consensus on this, that nobody wants to see that wall. And then if we had to have a historic advisory meeting for the window, we probably have to have it for this too. I don't know if we need to make a motion on this, or if we need to delay this.
Bring it back, we generally. Fine.
Okay,
Yep.
everybody
Sounds good to
like
me.
that?
Before we move on, we had a item on the agenda previously for a Garden Drive Travel Center. That item has been pushed back to February's agenda, but we did receive a comment submittal for that. Kayla, if we're able to.
I do not have that comment with me since it was pushed back.
For what center?
What is it?
It's a
The travel center.
When I had sent the packet.
Oh, yeah.
They actually didn't get the packet.
Oh, okay.
They just had the link, so when I updated it.
Okay.
Like another Maverick. This is what I heard a rumor of. Okay, I got it.
Similar idea.
I think it looks better than the Maverick.
Really?
The design, well, at least what he proposed so far anyway, so.
You guys saw it at the DRC.
Yeah, we saw
Okay.
it. I thought it was a very good layout. I really did, and it's gonna be in a good spot.
Yeah.
Yeah.
Did we have somebody that wanted to speak on that, or?
Okay.
If you'd like to still address. You can still share your thoughts.
If you have a concern, or if you have something.
We'd love to hear it.
No concern, I was actually saying go for it.
Oh,
Okay,
okay.
okay.
We're the exact land owner.
Oh, okay, yeah.
Thing that, to help area.
Yeah, it'd be good.
Yeah.
Yeah.
Storage and water.
It sounds like they're still working on that since it got
Buckets.
postponed, so yeah.
It will be the last Thursday of the month. I believe it falls on the 26th. Yeah.
Awesome.
Thank you for coming.
Thank you.
All right. Are we ready for the next item?
We will move to item 2.
Okay, so the next item that I have is a discussion-only concept for a health services overlay district. Recent review of a health service business application highlighted a reoccurring challenge. Existing zoning districts do not always provide a clear or appropriate location for certain health-related uses. This creates uncertainty for applicants, increases staff time spent on case-by-case interpretation, and can delay services that are needed in the community. In response to this issue, staff discussed the concept of establishing a health services overlay district that could be applied to areas where health services are already clustered or planned for growth. So here are just some of the few things that a health services overlay could do. The proposed terminology, when we previously discussed this, we had been using the term medical overlay. Staff recommends the use of the term health services overlay instead. Health services is more neutral, administrative, and community-oriented. Medical can imply hospitals or large institutional facilities only. It may carry negative connotations related to traffic, scale, or mistrust in some rural and minority communities. Health services better reflects a broad spectrum of care, including nonprofit providers, behavioral health, dental services, counseling, public health programs, and community clinics. This term services emphasizes support, access, and public health rather than solely clinical or hospital-based care. So some research and planning rationale. Research on rural health systems consistently demonstrates that medical care in small and geographically dispersed communities tends to be fragmented. Services are often provided by a small mix of small clinics, private practices, nonprofit organizations, and hospital-affiliated providers. This fragmentation can make coordination more difficult, increase administrative costs, and create access barriers for residents. Clustering and comprehensive health districts improve access, efficiency, and cost effectiveness while strengthening provider networks. Establishing a health services overlay in Oroville would help streamline the siting of health-related uses, reduce uncertainty for nonprofit and community-based providers, and promote a more coordinated medical and health services district. This approach aligns with broader trends in rural health planning focused on efficiency, access, and long-term community health outcomes. So this is my new proposal of the health services overlay. When this was brought to the Development Review Committee, it was a little bit smaller than this. We had expanded it to include some undeveloped land for potential growth in the area. So what I have here is the Oroville Hospital, and then where I have these stars are either are health services related businesses that are currently there. So it makes sense to group them together as they are right now. And then to, just have this undeveloped land to promote new businesses to come, new health services to come, and to grow there.
Love it.
Thank you. I like it too. I think the only thing I would say is I wouldn't want to see a health service on all four corners at Washington and Oregon.
That would be interesting. I would say,
Besides that, I think it's great.
I think it's great, but right down there at the bottom, I would say go all the way to Shear Memorial. All those small little ones, I would go all the way to, I would even include Shear Memorial in that spot, all the way to Foothill.
Can I add some expertise in here?
Yeah.
Work with community health centers across the nation and locating sites and finding sites that can operate and find and get access to the patients that they're trying to serve. I like the idea of creating a zone where it's going to be easier for these kinds of establishments to be able to locate and get through all of the planning hurdles, which there can be many, many hurdles. It's frustrating, especially in the city. Holy moly. But we have health facilities that could cluster in an area that's much larger than what we have carved out here. And really all the way down Oroville Dam Boulevard, and really closely approximates our already existing MXC zone. So to me, it would make more sense if we want to create a way to ease this, this regulatory burden, that we would make this an extension of the already existing MXC instead of creating a separate overlay that isn't going to cover all of the areas that might be affected or be able to benefit from the revised regulation.
So I'm confused. You're saying this isn't large enough? There's not enough open spaces in this area for?
I don't know why we would exclude other areas that have medical services.
So you're talking about areas that already currently have medical services. And I think the intention of this, more than anything, is to create the zoning and then apply it to different areas. Like as we expand and as we annex and as we grow as a town, like Chico has pockets all over the place.
Not just one area.
And then you don't have, I'm just gonna throw this out for example, you end up not having a rehab center in the middle of a bunch of apartments because it's got a pocket where the rehab, the dialysis, and everything is all in one little spot, and then it's surrounded by all the homes. And it's not so haphazard like Oroville is right now, where it's all spread out, where one medical facility is across town from another one. If we can start localizing the medical facilities and put them in spots, then we can grow, and we're we're not so spread out, basically.
Yeah, I
Yeah,
mean,
but that's a limited spot.
I'd say the same sort of thing. Just we're encouraging them to go there, and not saying
Yes.
not saying that's the only place they
Correct.
go.
They
Yeah.
can still get a use permit and go anywhere they want to go.
Okay.
With their use permit and proper channels and go through all the hoops and everything else. But if they choose to go in this area, it would just be easier, because this is an area already zoned for them to go into.
But another motivation that I have, especially in light of the new Butte County mental health facility that's coming at the old Western Motor Lodge. So we've got a big mental health facility coming. We have 2 Suboxone clinics right here in historic downtown. Quite a few drug rehab programs. We're quickly becoming a drug rehab destination. I feel like we want to keep our mixed-use downtown vibrant, shopping, safe, and I want to be able to have an area that's safe for people to get treatment. And also, another thing that's happening downtown that is affecting us is that people come for programs and they get kicked out or dropped out, because you know how you can't make them stay, and then they wander in our downtown district, and that's extremely harmful for them and harmful for us. So I'm also looking for a way to shore up the mixed-use downtown to make it more vibrant and safe by having a good place for these other businesses to go. That's my other motivation.
What's going on with the motor lodge? What motor lodge?
The old Motor Lodge on Bird, you know it, that AJ Beck owned.
The old,
Yeah, what, you guys have another name. you
McGuire
call it.
Suites? What's that turning into?
Butte County
Riverside.
Mental Health Facility.
It was Riverside Villas most recently.
Yeah.
So that's a very big
what's-
mental health facility in our historic
What
downtown.
does that mean?
Right up on Bird. That's the one
Yeah.
up there AJ has.
It's gonna be like at that
okay.
Feather River Activity Center, right? That's another.
Yeah, that's.
So that's I just feel like we're kind of getting these big buildings and it's disorganized. They don't really belong. They need to be in a location. Whereas
That
if
use
people
is
drop
allowed
out,
there?
they're okay.
That use is allowed there?
So per the state of California, you can't really tell them where they can and can't go. They can go anywhere they want to go. So by doing something like this, we're incentivizing them to go over there instead of down here. That's all we can do. They can go anywhere they want per California law.
No, but unless the location is not right. If we can deny if the location is unsafe.
Yes. And there are certain
Right.
parameters they have to go within.
That is part of.
Yeah. Right at the
halfway
FK.
down
Yeah.
Oro Dam Boulevard. Trying to think that through and maybe have a place to steer them.
We were trying to encourage them to go closer to the
To the
hospital.
hospital.
That was
Where it's safer.
Right, but there has to be enough space for that, enough land.
And you don't feel what
And-
she drew is large enough.
Well, there's a
Well,
lot
I
of
mean,
open land.
if you go down Oro Dam, I mean, you've got the physical therapy guy going on Oro Dam East. You've got, Dr. Smith's office, you've got the
Right.
dentist office. So, but that's not included in this overlay, right? So, I mean.
This is where we want to encourage it.
Well, of course, but how much available property is here?
Well, everything on the south side of Olive Highway.
Here's what I still
Well,
don't.
yeah, but it stops before you get to Wyandotte right here, right?
Well, but that's why I'm saying go all the way down to go
You
take all
gotta
the
go.
way to Sheer Memorial.
You gotta go down to at least
Yeah.
Foothill.
Yes,
Yeah.
exactly. That's what I had mentioned, is take it all the way to
Okay.
Foothill.
You gotta do that. And, I mean, it's my understanding that the dialysis clinic now is not doing their addition.
Oh.
I was told that because they were denied.
They were approved by
I
us.
thought we approved it.
We did approve it, but I guess,
Oh.
Control.
Mitigation.
you gotta raise a pad. Okay.
So what I don't understand is why we would incentivize medical buildings around the hospital, which, many of them are going to want to be, located around anyway, and not elsewhere where medical would be entirely appropriate, which seems to me, again, would be pretty much along the MXC corridor.
Which is all of Oro Dam?
It's basically along Oro Dam Boulevard, yeah.
Now, how about the hotels that are on Oro Dam? Does that fit in with
Well, the thing is, look,
their use?
here's the thing, we just denied a clinic to open on Oro Dam.
Right, it's very busy.
If we say, okay, go ahead and put a medical, I don't
Yeah,
see
yeah,
how we
yeah.
can, I don't see how we can do that. Besides the fact that in the discussions we all had, I thought we wanted retail there, I thought we wanted
Yeah.
other
We
things
do, a more
there.
commercial service.
Correct, more commercial
Yeah.
service. That's why we don't have a perfect answer on where to stick this. I mean, we could also go down to the Fifth Street and Oro Dam. We can go there and we can encompass the clinic. We could encompass what Jordan's Crossing is doing right there, and we can encompass CVS Pharmacy, and we could put a little miniature one right in there. That's something else we could do. And then we could put these little pockets all over the place. But the bottom line is just to have the ability to put the pocket in, so when we look at our zoning and we decide, okay, now here's our master plan, we're gonna grow out this way, we're gonna grow out this way, and when we do, where do we want the medical offices? Where do we want our pocket? Where do we want the next clinic? And things like that. That's the overall thought behind this.
Yeah, at this time, I think the biggest hurdle is just getting the language in our code for a medical services overlay. So if we just can approve that, we can include little pockets and we can like expand it and we can have different zones. But just right now, we're just reviewing, I guess, the terminology, the idea.
What if we just say where it's not allowed, instead of saying where it is allowed?
Because you can't do that.
Well, what?
You cannot say that, Glenn. Come on, you know that.
So what exactly is the burden now? What problem are we trying to solve here?
Is it the terminology, right? Is
Well, for downtown, and this one thing I wanted to know about this zone. When people come to get treatment, mental health, drug rehab treatment, they are not forced to stay. So, and they're coming in from other areas, other counties. These enterprises are growing, so they're bringing them in from other areas. Well, they drop out. And they wander through our downtown, not cared for, causing a problem. So it seems like there should be some accountability if we're gonna have a medical zone to where people just can't be dropped in areas. I know that that is impossible, but I guess that's personally what I'm trying, my biases.
Okay, I mean,
The treatment center in the Big Five, or the for kids only, is what this is, the reason this is going.
See, we don't have a way
Wait,
to.
what?
Nobody thought that was a good place, but nobody had a
Oh, the
a better
FKO.
place.
100%.
So this is
Right.
our answer to
Right.
showing that there is,
I get it.
that we say that there is a place.
Right.
Right.
That's a good point.
Because that was one of the things, is we were saying, no, we don't really want it to go here, but we didn't have a place to say, okay,
To
here, you're
encourage it, yeah.
incentivized over here.
And
No
this is
use
safer.
permit is already allowed here,
Right.
look, we're gonna help you out with this and
Right.
help you out with that.
Encourage
We
it.
Exactly.
Yeah.
Yeah.
So overall, the language is needed in the code and the zoning
Mm-hmm.
far more than we just need to pick a border for this particular
Mm-hmm.
meeting. We just need to,
But it'd
if
be-
we can get the zoning in, then we can apply the zoning anytime in the future.
so would it be easier to create the overlay or easier to amend the MXC zone?
I worry that if we amend the MXZ zone, that's changing all that zone.
Isn't FKO MXC?
Yes. Which would allow the clinic to just walk right in there and receive all the benefits. Whereas if we create a medical zone, or sorry, a patient health
Health
services zone,
services,
Yeah.
health services overlay.
Services.
then we can incentivize them and give them a larger, like, this is a
what
really
you're-
big area for them to find a spot to put a building.
So what you're talking about is creating a zone that gives them, it creates an area where they would be able to use as of right rather than having to have a use permit.
Yes, and then there'd be other things to it too, you know, close access to other facilities. The city in the future could look at more bus stops, and, you know, there'd be a lot of things that we could look at with the code to incentivize moving the medical office to this area.
I don't know
And-
if not giving them a use permit would be the way to go, but definitely encouraging them to go here.
Well, if it's allowed by right, if it's in the zone, it's allowed by right, they wouldn't need a use permit automatically, right?
Well, getting a use permit to put in medical is pretty damn standard across everywhere in the entire industry. It would not, I wouldn't, again, working in this, with organizations that deal with this all the time, I mean, sure, being able to make grid a location without having to without having to apply for a use permit, I guess it offers a certain incentive. It's just not common. I've never seen it.
Well, that's what the forward thinking about this is. If we can be forward in our thinking and be like, look, we want you to come to our town. We have this whole area here that we're incentivizing. Build here. We want your treatment center here. Here you go. And like with open arms, instead of, well, not in my backyard kind of thing, which is what they're getting all over the place. Everywhere they go, they get the not in my backyard. You know this because obviously you deal with this all the time. So if we could figure out a patient health services zone that we could direct them to and be like, hey, in our backyard, here you go.
In this part of the backyard.
Yes.
We'll
See,
help
it's
you get
this
in
part,
there.
because
Yes.
it also protects the other parts where
Yes.
it's not as appropriate.
And we still
So it does
can't tell
both.
them no to the other spot because California state law says they can go wherever they want. However, within, the border.
Within
of the
reason.
They would
school.
still,
That's
they
not
would
a-
still
that's
just be
I
be
know.
able to locate there with the
A
building
final
permit.
answer
Because-
with the state.
And
Right.
and
Okay.
also
I mean-
a lot of the folks that we work with are getting grants in order to make the investments that they're making in rural and lower income communities. And they have some requirements that they have to abide by and don't always have a lot of leeway in terms of where they can locate. And sometimes they have to locate, oftentimes, they have to locate certain distances away from other health centers that both federally funded and not.
Oh,
So
really?
yeah. There's an incentive to separate operations because, the thought process is that, is to be able to access more people where they live. They don't want, especially if they're serving lower income residents, they don't want to create a situation where they have to drive long distances to get the services that they want. They want to encourage the services being provided in the neighborhoods where they live.
And that's exactly what this would do, because once we create the zoning capability of having the health services, then we could look at Southside. We go to the south part of Southside, and we could create a spot in Southside for health services to go that benefits the community and also follows the general plan of how the Planning Commission and the council wants to see everything move forward. So it just gives us the ability to incentivize them to put them in different spots. So I guess more what I'm saying is we're not going to tell everybody in the city they have to go in this spot right here. We're gonna put pockets all over the place, especially as we grow as a city and expand.
Okay.
Does staff suggest there should be an incentive with this, or what does?
So, yeah, I don't have my list on me, I'm sorry, but I was following examples of other cities. In other states, it is more common for these health services overlays, particularly in like Ohio and Washington, in their rural areas. They have permitted uses by right, such as medical offices, outpatient clinics, physical therapy, behavioral health, things like that. That is the incentive here. And so I was following those rural examples. In California, the only example that I had was Beverly Hills, which is a little bit different than us, but
Just a little.
Not much.
I don't have any clients in Beverly Hills, no.
So not every health service would be by right. It would be
not every health
okay.
service would be by right. We can limit that to what you guys feel is comfortable. I do have some examples in the staff report that I had, like nonprofit community health providers, things like that, but we can be more specific about what it is you want to be permitted by right, but that is the incentive, is that there would be less administrative burden for them to go in this area.
Right. You try to encourage it.
Yeah.
Right, and all, like I said, all this does is it takes it from the battle of not in my backyard to, okay, we understand you're coming, we understand that you want to come to our city, we understand that economically it's feasible for you to be here, we recognize that we need you in the community. Could you think about going here? And then we have the incentives on why to go there, and then we get some census tracts and some reports of the people that are around there, and we show them why it would be beneficial for them to be in XYZ instead of ABC.
And I think we could deny because we have another place for them to go.
No.
Maybe suggest that they go over here.
you
instead of-
have
No,
to be
because if
careful
this is
about
not a
that.
good location, this is a retail location, this is not safe, but this is a good location. I think what's happened with the methadone clinic is that everywhere they've tried to go, it's not a good location.
Right.
So,
Yeah, you're right.
So what we're trying to do is we're trying to say, okay, instead of just having somebody apply and say, okay, here's where I want to go, and I say, no,
yes,
it's not a good
we're trying to
location,
No, it's gotta be
we're
consistent.
trying to steer the wheel here.
we could give them a list of, hey, look at all these spots.
Yes.
I could see that helping if somebody says, hey, I want to do this in your town, and we say, here, this is our
Yep.
recommended
Yep.
area.
Yes. Yep, that's the whole thought.
You got a lot less pushback here.
Yes.
Yes.
Couple of other staff comments. The list of facilities that are permitted by right.
Page 17 is potential permitted uses.
Yes, outpatient clinics, diagnostics, imaging centers, public health programs, and birthing centers.
I have my own report.
And
But is there a limit on the permitted by right? I mean, is there a certain number, like, you can have 4, not 14?
Well, this is such an early on conversation, isn't it?
Right.
It sounds like nothing is really like, this is our idea. This is, right now, we're very high level in our discussion right now, right?
This is the 20,000-foot view of what do we do to make it where we don't say just, or what do we do to stop saying not in my backyard? How do we accommodate and save ourselves the pain in the future of being able to accommodate?
Well, I mean, like Natalie said, it's gonna become a destination.
Well,
Downtown.
it's good,
That-
so,
Downtown.
Well, wherever.
Oh, yes, this
Yeah.
would be the destination,
Okay.
the health services destination. Yes, that's that's exactly it.
so population's gonna dictate whether they come here or not. They're already coming here.
Yeah, but if the services are there, then you will get more people coming. You'll get more customers.
You will, but at least it's here and not
Yes.
taking over FKO or something
Right.
else where we want a retail facility.
Right.
You're not going to win. This is.
Yeah, we are gonna win.
This is the compromise of, hey, we understand you're coming, have a spot.
Yeah.
there are a couple of other. One is that by medical facilities. Now I'm getting an echo.
Yeah.
That vacant land on the right side and going up is not all buildable. There's 2 high-tension power lines running through there, north-south. The most buildable area would be along 162 there, and it could go back, but it gets really steep as well. So there are some constraints to building. But in the case of the methadone clinic, they needed an existing building to occupy. They were not interested in building their own. So there's a very limited supply of available office or medical space here within this zone that's described here.
Right, and that's one of the reasons, in my opinion, we need to make the zoning capability and then take a look at all of Oroville and decide how would we like to move this forward and pick our spots.
But I think we do have to go all the way to Foothill.
Yeah.
Oh, yeah, 100%.
Because
It
of
needs to
all
go to
that
Foothill.
land that is along 162 right there on the
Yeah,
opposite, on the side of,
all those small lots down there on the bottom of the screen need to
Both
be
sides,
included.
actually, yeah.
Yeah, both sides, all the way to Foothill. Include Sheer Memorial in it.
yeah.
That's a personal health services of a kind.
You like that? Do we need more?
If you redefine
Did you get enough
health-
opinions?
Something to work on?
So I know this is just a discussion item, but are you, are you looking to get the feedback that you're getting here, or what?
Yeah, I guess I just wanted the feedback about if staff should move forward with, continuing this item. I can,
Well, we should definitely consider this.
okay.
What it looks like, I think will be up for debate, but we'll definitely, I would love to have this considered.
I can do a new map that extends it along Foothill, and then I'll do a draft code section too.
I think that's what we need to see.
Yeah,
next.
that's what we need to see.
I mean,
yes.
fidgeting about areas, I think, is secondary to what the code
Yes.
To
is.
the zone, what is,
Yes.
how is the zone actually defined?
Once we
And
define
what's
that,
its-
then we can
exactly,
pick
and
the
what's its
spots and
purpose.
circle areas and.
Yeah.
I have a concept of the municipal code in the staff packet, just like some terminology and things and potential permitted uses. But I can make something more concrete if you guys don't have any feedback on that draft. Any more feedback on that draft.
Yeah, this is everything you read to us. I thought this was good.
Yeah,
Yeah, I like it.
I would just like to see it expanded personally. I think everybody's on the right track and like Warren said, we just need to get into the minutia of the details and figure out exactly what the wording needs to be and then we can always draw red circles and lines later.
Okay. How do we feel about permitted uses by right?
Yeah,
Yeah. Okay.
what you chose on
I
yours.
mean, or would we still, you know, if it has a drive-through, would we still need a use permit and?
Yeah, drive-throughs are use permits, basically just the use itself, so like a birthing center wouldn't need to get a use permit.
Right, a pharmacy would not need a use permit, but if they wanted a drive-through, they would have to get a use permit for the drive-through portion.
Correct, yeah.
Yeah,
That's special consideration, yeah.
Is CVS taking over the old Rite Aid?
I don't.
Could you have CVS on here? I think, isn't that the old Rite Aid, because it's across from,
that's the old Rite Aid, yeah. They're not taking that.
so it's
over.
not CVS now?
No,
Okay, because I just confused, because it says CVS on there.
Oh, sorry, I think you, sorry. Have the old one.
no, but I think it'd be great.
I don't know
think
if you,
this is
have- sorry.
great. I'm sorry, I was just.
No, I'm sorry.
Shut up.
The, one of the things I was thinking of for the purposes is also the safety of the patients as far as walkable pathways, traffic, those types of things.
Great point.
So,
will
and I,
Make sure to add that.
yeah, just kind of in the purpose and intent.
You know, and I agree with Natalie too, something that maybe I need to expound upon a little further that I mentioned earlier is these areas that the buildings aren't built yet. I mean, yeah, I know there's new sidewalks in there, obviously, and all that, but you still have the potential of putting in more bus stops.
Yeah.
And if you go into an existing building like FKO, for instance, it's locked in. The bus stops across the street, and that's just where it is. Whereas if you go down towards Foothill, you've got lots of room down there. You can widen that street out, you can talk to Caltrans, you can put in all kinds of things. So yeah, I think it'd be a lot better.
Great, awesome, thank you guys so much.
Thank you. I guess that's our last item, and it wasn't public meeting, so that's closed. Do we have any commissioner reports? For Historical Advisory Commission reports? No?
Not quite yet.
No, no.
I have
Next
a,
week, next month.
I have a staff report that could come under Historic Advisory Commission. A couple of months ago, we promised to provide you a list of landmarks.
Yes.
And we have been researching this and have discovered it's not going to be as easy as we thought. The list of landmarks we've been assuming is those that are listed on the state or the federal historic register. And I have copies of all of this, but I don't want to inundate you with paper. I think I'd rather just talk it through for now. So there's about 12 to 15 on here. There's also a large list of City of Oroville commercial historical buildings and listings. They're on a historic list. There's a walking historic tour, which has other buildings on it. I went back to the general plan to see if there was anything there. And there, in fact, was a map in 2007 done by Jones and Stokes, which had 26 buildings, mostly in the Old Town and the downtown, that are historic structures in Old Town Oroville. Their 2009 map, which made it into the 2009 general plan, only has 16 structures. So it is unclear how many structures there are that are actually landmarks in town. It is also unclear that any of them have actually been designated as landmarks according to our ordinance. So we're still doing research on that. We're going back to find out which are on the list. The city of Paris is not on any list that I can see. We did review that building, and they voluntarily did a bunch of historic review. This old Ford dealership appears not to be on any lists. The Union Hotel, it's unclear about that, but I believe it is on a list. The State Theater definitely was on the list, and so we did the new marquee there as a landmark. The whole Washington block appears to be on the list, and the block next to it with the across Huntoon from it, Huntoon and Montgomery, where the new, what's the name of it that's going in there?
Big Tuna? Or-
Big Tuna, yes.
Yes, that one, that building is amazing. Yeah.
And so we still have to do research on this to find out what's actually been designated as a landmark. The only one that we're absolutely certain of right now is the Eamon
Wow.
home, because the city council in 2023 designated it as a historical landmark. So we're going to go back in our history and find out what else has been designated. If not, we will bring you some options with some criteria and ask you to recommend that the city council designate a certain set of buildings
Yeah.
as landmarks.
As
So-
Oroville landmarks.
As Oroville
Yes,
landmarks.
So that's what I see it as you got your national, California, but then we'd have our Oroville
Right.
ones,
Most
would
of them
be-
are in downtown, but not all of them. So,
right?
The depot, railroad depot is on the
Yeah.
suggested list anyway. So we'll be working through that.
Okay.
As we, and Connor, of course, is working on the historical guidelines as well that you've asked to get reviewed.
I didn't know
and
Connor was
recommend-
still working for us.
He is, and on an occasional basis. And so we'll bring that back to
Okay.
you
Oh,
as
good.
soon as we can get it all pulled together.
Because this is in the preservation district, but not that building. But the city, when I looked at the map, this
Yeah.
is, and then that way. Oh, sorry.
It's in the downtown historic overlay. The preservation district
Yes.
is actually down along Myers Street.
And it
It's smaller.
includes this when I looked at the, when I
Does
blew up
it?
the
Okay.
map, yeah.
Okay. So that's one.
Which I
with-
thought was interesting.
Preservation map I saw didn't include Myers, so we got to get this cleaned up.
Yeah.
Yeah, we
We
do.
definitely
That's the
do.
thing, yeah.
So there was two different maps in the general plan and all kinds of things. So we've got to figure this out.
But thank you. And the other thing is that zoning map, the interactive zoning map, you still can't get to it from the city page. I always have to copy the link and go out, but I don't know why. It seems like it's got to be an easy fix for the tech people.
Yeah, I don't know, the phone link works now.
Does it? You can get to it on your phone? Okay, because I tried just before I came and I couldn't.
That's what I was referencing it when I was talking about zoning.
And that's the one where you can put the address in.
I could, yeah.
That's not just the PDF.
No.
Okay, yeah, the interactive one is great, and I think it's
No,
the
this is
most
the
up to date.
ArcGIS one.
Okay.
Thank you. Any other staff reports?
In February, we should have a discussion on Development Review Committee, I don't know the word for it, commissioners that sit in on it.
Chairman and
I can do
co-chairman.
it again.
Okay.
Yeah.
I was told, actually last week unofficially, but yesterday, that we're approved for a grant to do a downtown revitalization playbook. So this is, it's being funded by Wells Fargo through 3Corps. They were allowed to choose 2 cities. All of the economic development coalitions that are in the North State were allowed to each choose 2 cities. So they chose Oroville and Corning.
Oh, very nice.
Yeah,
That's
so
awesome.
there's no money, there's no dollar amount that's attached to it. It's just the activity itself. So the planning staff and I will be working with some ODBA members to work through how this will look. So they'll take a look at the empty spaces, and it's what I've been sort of talking about for a while. What I'd like to do is to take inventory of what we have, see what we could use to fill in there, like what we kind of round things out, and then sort of, hopefully at the end of it, kind of create sort of an outdoor mall shopping experience.
Right.
Yeah.
That'd be great.
So, yeah, pretty excited about that.
You would have loved this, Pat. I thought of you. There's someone who wants to open a Pilates studio with retail in the front. So Lori Pierce and I met with her, and Lori Pierce knows every nook and cranny of downtown. We had a list of 12 spaces that would be awesome for her use. And of course, Lori has all the numbers of all the owners of the buildings, and we were able to reach out to them. But I thought that's kind of what you're talking about, getting people placed in appropriate buildings and meeting with them.
Exactly right.
And it
Well, I
was
think that
fun.
having it be sort of strategically outlined so that we get like a nice rounded shopping experience. When
Yeah.
people come here, when visitors come here, then there's something for everybody.
Yeah.
Yeah, they pop in and out of
That's the
stores and all
goal.
that
And
stuff.
you can separate the competition too. You don't get two next to each other. You spread them out. That way everybody's still walking around looking at everything.
Exactly right.
Like
yeah.
at the grocery store, they make you walk all the way there.
Oh, yeah, product
To
placement, that's
shop
the
in,
thing.
exactly.
Which,
So
by
we-
the way, we could really use something like that downtown.
I
you
want,
know,
I
a
know,
convenience store of
I
some
want
kind.
that,
Yep.
yeah, I know.
So there's one other thing. We discovered that there are two properties in the downtown that are zoned PQ.
Yeah.
And we want to clean that up. So
Yep.
staff is going to take the initiative to clean that
Thank you,
up. And
yeah.
then, so they're just, we don't know why they're zoned PQ or why they weren't rezoned with everything else.
Mm-hmm.
We have no records for what happened, but
It's got grandfathered in the last general plan, I think. But
Well-
yeah.
But we just changed some,
Yeah,
couple
we
years
did cha-
ago.
We did change.
Yeah.
that.
yeah,
well, across the street over here, like
Yep.
these were all
Yeah.
changed over here, right?
except for one building.
No, that one was changed also.
Was it? Okay,
It had already been changed.
okay.
Yeah. So the rest of them, but there's these other two that are sort of been just like oddly missed. So I talked to the owner of one of them. He said he would like to change. I haven't chased down the owner of the other one yet. So
Good, thank you for that. That's
Yeah.
something that we want to do.
that's it.
I just had one thing. It's Form 700 season, so I'm sure you've all received an email. Several of you have filed them already, but you do
think
have
I
until
did.
April 1st. I will, Natalie, I'll check your portal tomorrow if you didn't get an email. But you're welcome to file online. It's a pretty easy process, but if you'd like to set an appointment with me, you're welcome to do so.
You got mine?
Yes, I did. I got confirmation.
Can't remember if I did it or not.
And I think I did mine printed out and still emailed it to you.
Very thorough.
All right, if that's it, we will adjourn to February 26, 2026 at 6 PM.
And then don't we have like, didn't I see